ever-loving pace. In this video, we're going to talk about the heart and how nutritional deficiencies can directly affect its function.
One major issue today is that when people visit doctors, food and nutrition are rarely given enough importance, especially when it comes to heart health.
Diet is often overlooked, even though the heart is one of the most nutrition-sensitive muscles in the body and responds very quickly to nutrient changes.
There is plenty of scientific data available on everything we'll discuss, but here we'll focus on the most important points.
Let's start with abnormal heart rhythms, also known as arrhythmias. These usually occur when the heart's natural pacemaker is affected.
This pacemaker is controlled by the nervous system and depends heavily on electrolytes.
When electrolyte levels drop, the pacemaker can malfunction, leading to skipped beats, extra beats, or irregular rhythms.
Conditions like atrial fibrillation are common examples of this imbalance.
These calcium ions are crucial. When they flow into the muscle cells, it triggers the contraction we see here, powering everything from movement to a steady heartbeat. Now let's talk about calcium. Calcium plays a key role in muscle contraction, including the heart muscle.
Both low and high calcium levels can cause problems.
A calcium deficiency may cause muscle twitching, such as small spasms near the eye or in the limbs.
On the other hand, excess calcium can also interfere with normal heart rhythm.
Magnesium works closely with calcium. While calcium causes muscles to contract, magnesium helps them relax. That is why magnesium deficiency often causes muscle cramps, especially in the legs. In the heart, this balance between contraction and relaxation is essential.
The heartbeat follows a precise pattern of contraction and relaxation, known as systolic and diastolic phases.
If this balance is disturbed, the issue may be related to mineral deficiencies or even a vitamin B1 deficiency. Vitamin B1 is important because it supports the autonomic nervous system. A lack of B1 can disrupt this rhythm. Calcium balance also depends on vitamin D3.
Without enough vitamin D3, calcium absorption in the intestines is greatly reduced.
Vitamin D3 can increase calcium absorption many times over.
Vitamin K2 is equally important because it directs calcium away
from arteries and soft tissues and sends it to the bones where it belongs.
Both vitamins must work together to prevent calcium buildup in the arteries.
Another important factor is body pH. If the body becomes too alkaline, calcium transport becomes less efficient.
Proper stomach acid levels are also required for mineral absorption. Low stomach acid can interfere with how minerals are absorbed into the body.
There is also research showing that tiny microbes, often referred to as nanobacteria, can hide inside calcium deposits. These microbes may attract calcium as a protective shell, allowing them to survive in places like arteries, kidneys, or even the mouth.
In such cases, breaking down calcium buildup becomes important.
Along with addressing the microbial component using natural antimicrobial compounds.
Sodium balance is another critical issue. Too little sodium can make a person feel extremely weak,
While too much sodium, especially from processed foods, can raise blood pressure.
diets high in refined foods and low in vegetables often create an imbalance where sodium is high and potassium is too low,
leading to fluid retention and swelling. Completely eliminating salt while drinking excessive water can dilute electrolytes,
a condition known as hyponatremia. This can actually worsen dehydration because hydration requires both water and electrolytes.
Drinking large amounts of plain water without minerals can flush electrolytes out of the body and disrupt balance. Magnesium is essential for muscle relaxation and plays a role in hundreds of biochemical reactions.
It is naturally found in green vegetables because magnesium is part of chlorophyll.
A diet rich in vegetables also provides potassium, which is critical for nerve signals and muscle contractions,
including the heart. Potassium deficiency can lead to irregular heart rhythms and increased pulse rate.
Although blood tests may appear normal, most potassium is stored inside cells, not in the bloodstream.
So deficiencies are often missed. Potassium helps lower blood pressure and slow the heart rate.
Magnesium also supports healthy blood pressure. When insulin resistance develops, mineral absorption becomes impaired,
leading to damage inside blood vessels. Over time, arteries can stiffen, increasing the risk of cardiovascular disease.
Reducing excessive carbohydrate intake and avoiding constant eating can help correct insulin resistance.
Some blood pressure medications remove both sodium and potassium,
which makes maintaining potassium levels even more important.
Increasing potassium through vegetables can be a powerful natural strategy for heart support.
Angina occurs when the heart muscle cramps due to reduced oxygen supply.
One key nutrient involved here is vitamin E. Vitamin E helps maintain oxygen delivery to heart muscle and prevents cramping. Low levels increase vulnerability to heart stress. Foods rich in vitamin E include nuts, seeds, and vegetables. Arterial plaque usually begins after damage to artery walls, often caused by excess sugar intake and oxidative stress.
High sugar intake interferes with vitamin C absorption. Without enough vitamin C, arteries lose protection,
leading to oxidation, followed by calcium and cholesterol buildup as a temporary repair mechanism.
Heart attacks often occur during intense stress. Stress hormones normally widen coronary arteries to increase blood flow.
However, if the adrenal system is exhausted, arteries may fail to open properly, increasing the risk of a heart event.
Especially if plaque is already present. Vitamin B1 helps prevent heart enlargement, a condition known as cardiomegaly. Deficiencies can also raise heart rate and contribute to breathing difficulties.
Other B vitamins, such as B2, B3, and B6, support proper widening and narrowing of blood vessels.
Deficiencies can lead to excessive constriction and increased cardiovascular risk.
Vitamin B3 supports healthy cholesterol levels, but its effectiveness is limited if sugar intake remains high.
Excess sugar can be converted into cholesterol, so dietary sugar reduction is essential for true cholesterol control.
The goal of this discussion is to raise awareness of how deeply nutrition influences heart health.
Understanding these connections helps prevent problems before they develop, simply by supporting the body with proper nutrition.
Understanding these connections helps prevent problems before they develop, simply by supporting the body with proper nutrition.